I really believe that this work and the way that we undo this, that we undo the system of white supremacy of which healthcare was built upon and continues to engage in, is that we have to start with ourselves. And I think the greatest thing that we can do for the patients and the families that we're working with is acknowledging that we all hold isms, and since we're talking about families of color, that we all hold racism, because we are working within a system that has historically been racist and continues to be for many patients and families. So if we can just start there and recognize that every family of color that walks through the halls or walks through the doors of a healthcare system or a clinic or that sort of thing are entering into that space fully within their identities, whether or not they have a conscious awareness or not, right? And it's how we treat them, we being the system, because I'm also part of the system, right? It's how we treat them from their first moment of contact. And so if we can start with ourselves, we can identify ways in which maybe we are perpetuating harm as individuals who are part of this larger system. We can, whether it's that, a family comes up to the reception desk, or a patient comes up to the reception desk, and the receptionist doesn't acknowledge them, but then acknowledges a family who maybe they may have a racially congruent identity with, right? Because so often people of color are invisible. I think probably every person of color can tell you about a time when they've been invisible within a system. And so it's making sure that we truly see the person who is standing in front of us, right? That we acknowledge them, that we acknowledge them in a respectful and inclusive way, which, maybe, hello, good morning, how are you? It's nice to see you today. What can I help you with? Right. And it can be those little kind of micro interactions that can begin to set a tone within a system, right, of treating folks with respect. And like I was saying earlier, it's also about recognizing that I have internalized racism, right? And if we can acknowledge that is a common experience that we all hold, right? Then, and we can openly talk about it. I think we're so worried about, especially within systems, we're so worried about being seen as racist, that there are times, and I call this, and I'm going to write about this one day, Blythe, I call this, like, we get stuck in this shame spiral, right? Of like, oh no, I said the wrong thing. Oh my gosh, I'm such a bad person. Oh my gosh, does this mean that I'm racist, right? And instead, it's interrupting that shame spiral and saying, okay, I made a mistake. And now how do I be accountable to that mistake? Oh, I'm sorry, Mr. So-and-so. I realized that I looked past you at the person behind you, and I apologize for that. And I will do better next time. Right? Because so often people of color, Black people, we don't get that accountability piece. Folks aren't necessarily accountable about the harm that they've perpetuated. Instead, they get into this shame spiral, and that stops the conversation, right? Whereas if we're accountable to the harm that we perpetuated, even if we think it was like a little tiny thing, right? Because sometimes those little tiny things, they build up over time, and they continue to build up, and then it becomes a story, right? And the story is, well, I don't like to go to this clinic because every time I go to them, they ignore me and they don't talk to me, and they don't see me, and they don't believe my lived experience. And so it's really those micro interactions, because we talk about microaggressions, but there's also micro interactions that can be positive,